Coastal Women's Healthcare has been helping women to achieve pregnancy for over 30 years. We understand that there are many unique situations that require the use of donor sperm to achieve this goal. The use of donor sperm is an option for same-sex couples, couples with male factor infertility, and for women who desire pregnancy without a partner. Sperm is available for you to purchase through many cryobanks throughout the country. We recommend ordering from a reputable cryobank as to ensure you are getting sperm that has been properly screened as recommended by the American Fertility Society. We recommend using one of the following cryobanks: California Cryobank, New England Cryogenics, or Fairfax Cryobank. All frozen sperm has been pre-screened for sexually transmitted diseases and has been quarantined for a minimum of 90 days prior to release as recommended by the American Fertility Society. As of 2007, specimens should have the FDA-required paperwork, which includes the summary of care on the donor and who the sperm is being sold to. Coastal Women's Healthcare will only perform intrauterine insemination with donor sperm that has the FDA-required paperwork and for the patient who is listed as the purchaser of the donor sperm. To purchase donor sperm, you will have to set up an account, browse the donor catalog, and purchase your choice. The cryobank will ship your specimens to our office, and we will charge $50 a month for a storage fee. Our office will only accept 3 specimens at a time, in cryo vials only, so please take this into consideration when placing your order. Inseminations are offered Monday through Friday at Coastal Women's Healthcare at a charge of $258 for the procedure and $50 for the thawing of the semen specimen. Saturday inseminations will be performed at Boston IVF. Coastal has had a close working relationship with Boston IVF for many years and plan on continuing our relationship with them. Boston IVF is located less than 1 mile from our office, northbound on Route 1 at 778 Main Street, Suite number 2 in South Portland. If you are to be inseminated at Boston IVF, they require a copy of your last visit, demographic information, and donor semen information that we will release to them. They will contact you directly with instructions and an appointment time. A government-issued photo ID or driver's license will be required upon check-in. Boston IVF is accommodating you by providing a physician and/or nurse, so please be aware that your appointment on Saturday is not subject to change after 12 noon on Friday. Payment is expected at the time of service. Coastal Women's Healthcare will arrange for the transportation of your specimens on Friday afternoon in order to be available for your Saturday IUI. The treatment for infertility is not always covered by your insurance policy. We ask that you contact your insurance company to verify whether you have coverage. Payment is due at the time of service if these services are not covered by your insurance. There may be pre-certification or notification needed in order to have coverage. It is your responsibility to notify our office before the appointment if pre-certification is needed. Procedure codes can be found in the patient forms and information section under the fertility section of our website. Intrauterine insemination, or IUI, involves placing the washed donor sperm cells inside the uterus using a sterile technique. To be successful, IUI must be carefully timed to coincide with ovulation, indicated by a woman's monthly increase in luteinizing hormone coming from the pituitary gland and then appearing in the urine. The increase in LH can be tested through LH surge kits, also known as ovulation predictor kits, or OPKs. These tests can be purchased at any pharmacy. Follow the instructions on the package, checking your urine daily, beginning about 3 days before your expected ovulation. For a woman with a 28-day cycle, ovulation typically occurs around day 14. We recommend testing mid-morning around 10 a.m., not using the first urine of the morning, and using digital tests which allow for easier interpretation of the results. When you have a positive result, call our office by 12 noon that day to schedule your IUI for the following day. If a holiday is on or near the day that you may need to be inseminated, please call us a few days in advance to discuss our schedule. In order to achieve maximum motility of the semen specimen, our lab will start the thawing process 60 minutes prior to your scheduled IUI in the office. Please be aware that if you do not show for this appointment or if you have to cancel with less than an hour and a half notice, you will be charged the cost of the procedure, and Coastal Women's Healthcare will not be responsible for the loss of the semen specimen. At the time of your appointment for the IUI, your provider will place a speculum in the vagina and pass a small sterile tube through your cervix and into your uterus. The sperm solution is passed through this tube. The whole process should take only a few minutes, and you will be instructed to lie on the exam table for 10 to 15 minutes after the IUI is complete. If you do not have a period within 17 days of the IUI, please take a pregnancy test. Complications from an IUI are rare and include the following: cramping in about 5% of women, minimal spotting in 1% of women, mild nausea in 0.5% of women, and possible infection of the uterus and/or fallopian tubes in 0.2% of women. If after several cycles you have not conceived, please make an appointment with your provider to discuss your plan of care.